Hey, it's Edge, back with another health highlight from Michigan Primary Care Partners and Y102. This week's topic has to do with the disease that some people suffer through and you never even knew that they had it. It causes widespread musculoskeletal pain, frequent migraines, extreme fatigue, sometimes IBS, sleep and mood and memory issues, as well as muscle spasms. I'm talking about fibromyalgia, and this is something that I personally know a couple of friends who suffer through this, and it's a daily battle just to find relief to get through it. So, in this week's Health Highlight, we're going to focus on how Michigan Primary Care Partners specialists diagnose the condition and also help patients find relief from this issue that they desperately are seeking answers for. Also, what is more on the symptoms of fibromyalgia, and last but not least, why your gender could play a part in suffering from the condition. In this week's Spotlight on Fibromyalgia.
In the United States, it's about 1 to 2% of patients that have fibromyalgia, and it's 8 times more likely in females. Fibromyalgia is a non-inflammatory chronic muscle pain syndrome. For fibromyalgia diagnosis, one part of it is having pain in diffuse areas, meaning both sides of the body and above and below the waist. And it can change from time to time. There's certain trigger points on the examination that are gone through for the diagnostic criteria. There can be some numbness and tingling in the arms or legs that is in a non-specific dermatomal pattern, meaning could be all over, and those are some of the first physical indications that you may have fibromyalgia. Fibromyalgia treatment can include pharmacological and non-pharmacological options. The non-pharmacological options would include physical therapy, which really would help you develop an exercise program. Aerobic exercise and weightlifting is actually recommended for long-term treatment of fibromyalgia. Also, a pain psychologist could be important to help you with developing cognitive behavioral therapy skills to help you cope with the chronic pain syndrome. And then as far as pharmacological treatment, there are multiple medications that have indication or that are used for treatment of fibromyalgia, and most of those include SNRIs and SSRIs and some different antidepressant medications. There's still a significantly unknown etiology of what is causing fibromyalgia, and if there's any specific preventative way to go about that, science is still trying to find that answer.